So we are going to be using the modified stroke scale, which is a little bit different than the full NIH stroke scale, for which there is certification. And the modified NIH stroke scale is shorter and simpler and has gotten rid of 4 items that the full NIH stroke scale has, and 1 item that's modified. So the items that are now missing is the level of alertness. We don't make an assessment whether the patient is sleepy or awake. We don't look for a facial droop anymore or facial weakness, and we make no assessment of slurring of the speech, dysarthria, and there is no longer ataxia on finger to nose scored, because these 4 items were found to be very unreliable between examiners and could not be reliably reproduced. And the sensory item is still present on the modified stroke scale, but has been simplified to just normal and abnormal. So anything that's abnormal in sensation scores 1 point. Good morning, Louis.
Good morning.
How are you this morning?
Pretty good.
I'm here to do a quick neurological exam to see how you're doing.
Okay.
So let me ask you, what month is it now?
August.
And how old are you?
32.
Okay. Now, can you open and close your eyes? And let me see you make a fist. Open and close your hand. Very good. Now, I want you to look at my finger and follow my finger carefully. All the way over here to the left, and all the way to the right. Very good. Now, close your left eye with your hand. And look right at my nose and tell me how many fingers you see.
1, 2.
Okay, now close your right eye. And again, look at my nose and tell me how many fingers you see.
1. 1.
Okay, good. Now with your right hand, I want you to lift it up about 45 degrees for 10 seconds. And I'm going to count 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And how about with your left arm? Yep, get up, very good. 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Okay, and how about your right leg? Put your right leg up for 5 seconds. 20, 21, 22, 23, 24. Okay, very good. How about your left leg? 20, 21, 27, 23, 24. Okay, good. Now, if I touch you over here and over here, does it feel the same?
Yeah.
If this is 100, how much would this be?
50.
Okay. How about here and here? Does it feel the same?
No.
So if this is 100, and how much would this be?
50.
And how about your legs? Here and here.
Same. 50.
Same? 50? Okay. Now let me ask you to describe what you see in this picture over here. If you want, you can hold it. So what's going on over here?
So I see a woman washing dishes, and with the sink is overflowing.
Okay. Is something bad happening over on the other side?
No, I see the woman.
Okay. See any more people over there?
No. No. I see there's a lot of water like overflowing.
Okay, good. And how about here? What are these objects here? How do you call this?
That is a glove.
And here?
A key.
And here?
Chair. Okay. Cactus.
And how about this?
Feather.
And here?
A hammock.
Okay. Now can you read these sentences for me?
You know how, down to earth, I got home from work. Near the table in the dining room, they heard him speak on the radio last night.
Okay, very good. And now let me do one more thing. I'm going to touch you, and I want you to tell me where you feel me touch you, okay?
Okay.
So you can maybe close your eyes and tell me where am I touching you?
This arm,
Okay, and how about now?
this arm,
And how about now?
this leg,
Okay, and now?
this leg.
Okay, good. Thank you.
Just normal.
Okay, so we'll go over the different components now, and I'll explain them to you a little bit, how to correctly do them and what to look for. So beginning with the first item, which is just to check orientation. So we're asking for the month, we're asking for the age, and that's pretty straightforward. If you miss one, you get 1 point for either one of those items. And then the second one, we are following commands. Again, very straightforward. We're asking just simple commands. You may want to mix it up a bit so you don't always ask them to do the same thing. In this case, we ask for eye closure and for making a fist. And I think it's important that you don't show the patient actually what you want them to do, because that is a bit easier to do because you're asking them to mimic, and that's an easier brain function than just to do it spontaneously without being prompted. And then we get to the eye movement examination, and if you noticed when we first examined Louis that he had a gaze deviation towards the right side, which he's showing now, you can see that the eyes are deviated to the right. That's a sign of a cortical stroke and would score 1 point if I can't get him to look over to the other side. So I asked him to follow my finger, and you saw that he had maybe some difficulties, but come on, give it a try. But was able to look over there. So you can overcome the gaze deviation, which is 1 point, if he has something that's called a forced deviation, where he only looks at the right side. And I ask him, Louis, look over here. And I try even twist his head to get him to look at my nose, look at my nose. And I can't do it, that would be a 2 on the stroke scale. And then the other thing to look out for, if you have a cranial nerve palsy, meaning if only one eye doesn't move horizontally, like with a cranial nerve 3 palsy, then I don't know if Louis can mimic that. Okay, good. So if he looks over here, you can see that one eye goes across and the other one does not. That would also score 1 point. And then we moved towards the visual fields, where I had asked him to cover one eye, and we were testing the 4 different quadrants, right? So both superior and both inferior, left and right. And make sure you can either do it by showing 2 fingers, or you can do it by telling me when you see the finger move. I prefer when the patient finger counts, because I think that's more elegant and easier to do. And you're testing all 4 quadrants, looking for visual field loss. He had a visual field loss down the middle on both eyes, and that's the reason why he scored a 2. And then we also checked visual extinction, which is where I flashed my fingers in both of his visual fields and asked him to be able to count both fingers, and that checks for something that's called extinction, where you again usually don't see the finger on the left side if you're being shown both fingers. So maybe we can demonstrate that again. You can either do that with the eye closed or with both eyes open. We'll do it with both eyes open now. So how many fingers do you see?
1.
So he didn't see the hand over here, the 5, even though I showed both of them to him, and that's a sign of neglect. In this case, the neglect is visual extinction, and that scores a 1 point further down in the neglect section. And then the motor is pretty straightforward. You would want the arm to be sort of 45 degrees against the plane of gravity, and you're counting till 10 and looking for any drift. And the important differentiating part here is if the arm does not hit the bed, you score 1. If the arm goes down pretty quickly within the 10 seconds and hit the bed, you score a 2. Want to show us that? A 2, it goes down, 21, 22, that would be a 2. And then a 3 would be, try and lift up your arm, see if you can get it up. Not being able to get it up against gravity. And then a 4 is just, not even a flicker, just completely paralyzed. And then you do the same for the other arm, and okay, that would be no drift, a little drift, but not hitting the bed. And then just minimal effort against gravity. Again, that would be a 3, not being able to get it up fully. And then again a 4, nothing. And with the leg it's the same, except for you're counting only till 5 seconds here, and it's the same grading scale again. So hitting the bed within 5 seconds would be a 2. If you don't hit the bed, it would be a 1. Very good. And then sensory, I think we can do sensory just checking light touch, and you really want to compare both sides and asking the patient if this and this feels the same, and you're looking for any differences in sensation. You can probably simply ask him, does it feel the same? Some people like to call this 100%, and then how much would this be, perhaps to quantify it a little better. But I think both approaches would be equally valid. And try to get a feel if it's the face, arm and leg, if they're perhaps differentially affected. And then we move to speech, which is also pretty straightforward. One thing I think to be careful about is that as you're talking to the patient and giving instructions, you can get some sort of feel for whether the patient has a speech problem such as an aphasia, but very often an aphasia will come out a lot better if you show them the cards and you ask them to name. Sometimes there can be an individual naming problem and even an individual reading problem that you might not pick up just by conversation with the patient. So I think it's important to do these cards. I know it's a bit of an extra time burden, but I think it's going to be very effective. So just ask them to describe, and you maybe prompt them a little bit, you know, how many people are there, is anything bad happening, just to get them to speak a bit more spontaneously, because sometimes patients are not as talkative as we want them to be.
So there are 3 people. There is a woman that's washing the dishes and the sink is overflowing. There's a child on top of a chair that's basically gonna fall from the chair, and he's trying to get cookies out of a cookie jar. And then there's a girl eating cookies.
Perfect. Okay, and then the naming we've shown you earlier, just make sure you name all the different objects, and perhaps keep the hammock for the last, because a lot of people find this to be the most difficult one. And then the same with reading. Again, reading can sometimes be independently affected, even though speech is otherwise pretty normal. So you may not need them to have them read everything, but perhaps just the top line, which is the simplest, and then the bottom line, which is the hardest. So
you know how they heard him speak on the radio last night.
Very good. Okay. And then the last section was a neglect. We checked neglect already when we did the visual fields, so we sort of took that part earlier, since we were taking visual fields already. And now we're just looking for sensory neglect, so more evidence of neglect. And that's where I had asked him to close both of his eyes and tell me which side of the body I'm touching him, and I want to make sure that he feels it here. Mm-hmm. So close your eyes and tell me where you feel me touch you.
Right.
So you do the right side first, and you test the left side, make sure it feels it there. Mm-hmm. And then you do both at the same time, and that's where you get the problem. If somebody has a subtle deficit, subtle neglect, they will not feel it on the left side typically when you touch both sides. And you can do this for the leg and for the face, and that concludes the modified NIH stroke scale.